Hey, this is Patrick Commiskey at Eye Associates of New Mexico here in Albuquerque. Just wanted to start talking through this case and kind of what we do. So at this point, the patient's been relaxed with our anesthesia provider, and there I just put a little bit of numbing medicine inside of the eye as well so that the patient is totally comfortable during cataract surgery. That little bit of gel material just holds space in the front of the eye while we work. It's called a viscoelastic. Sometimes patients feel a little bit of pressure during that part of the procedure. Here you can see on the left side I'm holding the eye nice and steady with that second instrument while I open the capsule, the front of the capsule that's holding the cataract. You know, the cataract's sort of like a peanut M&M, so we're taking the shell off of the front of the M&M so that we can take out the chocolate and the peanut part. So this little bit of procedure there is to add some fluid in between the capsule and the cataract itself. That allows for the material to spin freely. And my apologies for having a little bit of this video outside of the frame. You know, my view as a surgeon is a lot wider than what you're able to see here, so it looks like we're off the frame, but you know, my view is really pretty good. So my technique for you know, taking the cataract apart is to basically divide it into some quadrants. It's pretty atraumatic, meaning not a lot of energy or excitement inside the eye. Then I tend to keep the phaco probe, the little ultrasound probe that's in the middle there, just kind of in the center of the eye. I can really see that the video there is a little bit off to the top of the screen. Just goes to show what a broader view that I actually have while operating. There, most of the cataract material is out. What's left there is the cortex, almost like the bits of the chocolatey part of the peanut M&M that are still kind of attached to the capsule. So we use a slightly different probe to go in there and remove the little bits of the cortex that are still adherent to the capsule. And we do that pretty quickly and efficiently there, and do a little bit of polishing to get rid of any stuck little cortical parts. So here we're going to put a different kind of viscoelastic, a different kind of gel inside the eye just to hold the space there. And again, I use that second instrument to stabilize the eye as we insert. Eventually, I think I'm just kind of waiting for the lens. There we go. We just insert the lens there. I like having the inserter nicely inside there so it's nice and controlled. So here, our lens for this surgery is the B&L Bausch & Lomb enVista toric lens. So this is a wonderful lens. You can see how nicely it unfolded so quickly. I love this lens because it of course corrects astigmatism, which is wonderful to treat at the time of cataract surgery, resulting in a very crisp picture without glasses. The properties of this lens that I really like for patients is that it has a neutral spherical aberration, meaning that it doesn't add any bit of blur or defocus from a sort of spherical, property of the lens. So here you can see I'm kind of nudging it because there's those little lines on the edge of the lens where the power is located. So, well, this is just a wonderful lens and just a very routine case there. Happy patient. Take care.